How does lymphoma affect your spleen? Imagine your immune system as a busy network of roads and stations, with the spleen acting like a crucial hub. When lymphoma, especially non-Hodgkin lymphoma, develops, it can impact this vital organ in several ways. Since the spleen is part of the lymphatic system, which helps fight infections and filter blood, lymphoma cells can invade it just like they do other lymphatic tissues. This invasion often causes the spleen to enlarge, a condition known as splenomegaly. When the spleen becomes enlarged, it can press against nearby organs, leading to discomfort or a feeling of fullness in the upper left side of the abdomen. Sometimes, this can happen even after eating small amounts of food because the enlarged spleen takes up extra space. In some cases, lymphoma can originate directly in the spleen, although this is less common. This is called primary splenic lymphoma. It can be tricky to diagnose because its symptoms and imaging results might look like other spleen problems, such as infections or abscesses. Usually, doctors need to remove the spleen surgically and examine it closely to confirm the diagnosis. Certain types of non-Hodgkin lymphoma are more likely to involve the spleen. For example, splenic marginal zone lymphoma primarily affects the spleen and is sometimes linked to infections like hepatitis C. Other subtypes, such as follicular lymphoma and lymphoplasmacytic lymphoma, can also involve the spleen. When lymphoma spreads to the spleen, it can interfere with its normal functions, which include filtering blood and managing immune cells. This disruption can cause blood cell counts to drop, leading to anemia, easy bruising, or increased infections. Because the spleen plays a role in removing old or damaged blood cells, its involvement by lymphoma can cause abnormal blood counts, making patients feel tired or prone to bleeding. Treatment depends on how much the spleen is affected and whether symptoms are present. If the lymphoma in the spleen is causing no significant problems, doctors might choose to monitor the condition closely without immediate treatment. When treatment is necessary, options may include targeted therapies for the specific lymphoma subtype, antiviral treatments if infections are involved, or sometimes surgical removal of the spleen, known as splenectomy. This procedure can help reduce symptoms and improve blood counts, but it also requires careful consideration because removing the spleen affects the immune system. In summary, lymphoma can influence the spleen by causing it to enlarge and disrupting its normal immune and blood filtering roles. This can lead to symptoms like abdominal discomfort, fatigue, easy bruising, or increased infections. Understanding how lymphoma affects the spleen is important for diagnosis and management. If you or someone you know is dealing with this condition, it's essential to work closely with healthcare professionals who can develop a personalized treatment plan based on individual needs. Always seek medical advice for proper diagnosis and tailored care.